New report out today is looking at the state of women's health care access and outcomes across the country, comparing the findings to other high-income countries.
And the results are pretty sobering. Here to break down these findings is board-certified OBGYN Dr. Jessica Shepard, and Dr. Darien is back with us as well. Dr. Shepard, I'd like to start with you because this study compared the health of women in this country with women in Australia, Canada, France, Japan, and the UK. What did it find?
Yeah, this report again is showing when we think of the U.S. against these high-income nations is that U.S. women face a 5-year life expectancy gap. So that's not great because when we think of the advanced healthcare that we have here, we really should be at the same level or even above. Now, who fared the worst? Black women fared the worst, which again, as a black woman and knowing what happens when we think of disease and conditions in the U.S., black women tend to do worse. So we obviously have to do so much better there. And then life expectancy. So the average age of women in the U.S. is 80. Now, why is that not so great? Because when you look at all these other countries, high-income countries that we were compared to, we had the lowest life expectancy. So again, overall, when you think of looking at us against high-income nations, we really should be doing better. So we have a lot of work to do that's going to come in with research and again, advocating for women's health and letting them know that their health is just as important.
And Dr. Darien, we see women's health disparities across the U.S. in emergency rooms. What did the study find and what are you seeing firsthand?
What I'm seeing firsthand is reflected in this study. Black women are using emergency rooms at the highest rate of unnecessary ER visits. What does that mean? That reflects a lack in the ability to access primary care. Also coverage. Over half of the United States Hispanic women are uninsured. Now, of course, that creates a limitation to seeking out the help that you need and the affordability of care. Significant gender pay gaps, as well as a lack of paid family leave. These things make it difficult for women to seek out the care that they need. Our healthcare system is under tremendous stress, and when that happens, it cracks. And when that happens, the most marginalized groups fall through, and that is who we have to pay attention to, women of color.
Dr. Shepard, I have to ask you, how do women advocate for themselves to get the care they deserve and that they need?
I love that you use the word deserve because I think so many people think that women are not deserving of this care. But really, it comes with collective, being collaborative. Women really need to band together in order to offer support for other groups that they may not even be in, right? And so collectively, if women can advocate for themselves, but also through legislation, what bills are passed and what we're bringing to Capitol Hill. And last but not least is the relationship that women have with their physicians. If they don't feel that they're being heard, is to find another physician who's also going to advocate for them as they find what is the best way that I'm going to get the best outcome and best quality of life.
Dr. Shepard, Dr. Darien, so lovely to have you both.
Dr. Shepard, good to have you back.
Good to be here.
All right.